computer. Okay, let's hope I'm recording. All right, we'll find out. Any questions to begin with? Okay.
Yes, Professor Coleman, I do have a question.
Laura, go ahead.
Yes. So for my assessment paper, the major stressor for my family was between the primary historian and her mother-in-law, just a stressful relationship.
Uh-huh.
So for the intervention paper, I'm kind of wondering, what topic to discuss as the intervention.
Huh.
I'm thinking should I go for meditation, something that she could.
Well, that's a good idea. So frame it in terms of anxiety, and then you'll be able to find something. Hearkened me back. I remember when I was newly married the first time, I went to assertiveness training and I was having trouble with my mother-in-law. And the woman introduced it by saying, "This will work with everybody except your mother-in-law." So I just had a little flashback there. But yes, I think anxiety and then meditation or guided imagery but just one of those.
Okay, but how would I discuss the statistics of am I just looking at family stress in general?
Or anxiety in general. That's about all you could do. You're never going to find statistics for mother-in-laws.
Right, like
relationship. I am now. So, so just give a general overall anxiety, or I'm sure you could get away with saying there are no statistics for relationship issues between daughter-in-laws and mother-in-law. Either one will just give a rationale.
But is it okay to use anxiety even though she didn't specifically say she has? She's not diagnosed with anxiety.
Right. You're semi-diagnosing it. That this is causing her stress, right?
Stress, sure. Yeah. Okay, thank you.
No problem. Does somebody else have another question? Okay. So I just want to go over a couple of things from the last paper. I was surprised by how many people got her and she mixed up. And since I don't know if you guys are I don't remember who did it. So it's very easy to tell if you should use the word she or her. And this happened when people were discussing, obviously, more than one person. So obviously, if you'd write, "She went to the market." But if your people wrote, "Her and her husband went to the market," and I'm saying if you just change that into singular, instead of saying her and her husband, if you said "she went to the market," you would know it's not her. So that's just a little grammatical hint. The title belongs on the second page, centered. Do all of you know what I mean by that? I should get a paper.
Yes.
Okay, good. And people were not putting it there. And then for some crazy reason, APA does not use introduction as a heading. They use conclusion as a heading, but they don't use introduction. So just do the heading on page 2. You have the title page and then page 2, did I say heading? Use the title, and then right after that, just go into however you're starting, or anxiety is a big problem in the United States, blah, blah, blah. So don't use that. And I just found out that they are coming up with a new APA. God knows what idiocies they'll come up with this time, but it is what it is. Number C is no page number unless quoting. And I know this confuses you because one of the faculty members insists on you having it. She will be the only faculty member who does that because that's not APA, and I have no idea why she needs it. But APA says no page number unless quoting, so get out of that habit. Especially most of you, if not all, will be in research next semester with both Amanda Brown and myself. So we follow APA. Reference page goes before the appendices. You probably won't have this again, but I thought I'd just mention it. Questions?
Professor, you don't want us to put headings in this paper though, correct?
It doesn't matter to me. People
Okay.
are using headings, absolutely. It's sometimes, I'll tell you, I think it's easier for faculty to follow if you do the same headings as the rubric without the word introduction. That one you can't use. Because now I'm grading half the papers. I have half the class. And I'm not saying that so you all go, poor baby. I'm actually enjoying it. But I sometimes, if I do too many at once, I definitely become brain dead. And I'm not talking about this semester. I'm talking about in the past. I've missed sections that people have written when they don't have headings. So it's not that you really need the headings, but it'll save you from having to go back to me and say, absolutely, I discussed the intervention. Look on page 2 to 3. So if you have a heading that says intervention, it kind of gets me out of my brain dead if I'm reading too many. And I kind of have to read too many at once, because especially with this one, because it's due the 2nd, and I can't remember what the last day of class, I think, is the 9th. So I have to have them all done by the 11th. I have to have your grades in by the 11th. So I'm kind of stuck.
Professor Kalman?
Yeah.
I think somewhere within this file, maybe somewhere else, you have stated that you don't want headings. So you might get many papers without them.
It's on the guidelines, Professor Coleman. It just says the paper should flow from one section to the next without the need for headings. So
yeah.
The need. Okay, I seem to have lost my pen. Hang on, let me just write this down, because I'll put out, let me get myself a pen. You know what? I write those guidelines. I don't know how I do this. I may have said, it's true. You don't need it, but it does help. But thank you. I will make a note of what we said. Okay. Headings help. And you know what? Nobody's going to get points off if you don't put headings down, just so I'm clear. So, okay. So intro, I think that's pretty clear. And then end always, and this will be for the rest of your papers, end with a purpose statement, which won't be the same purpose as your assessment. It'll be a different purpose of the paper. Then just give me a short paragraph on the family that's going to be relevant. So I don't need to know about the aunts and uncles. I may not need to know about the siblings. It just depends on what your issue is. But enough so that when I'm reading the paper, I go, oh, I remember what Jamie's paper was about. Because again, I'm reading so many that it's not staying in my brain, to be honest. So just a little bit. Is that kind of clear?
Yeah.
Yes.
Okay. So then the lit search. Lit search is the big thing, and just so you know, you're going to do it the same way in research next semester. We want to know how you did your research. First of all, use more than one database. Let me write that down in case it's not in the guidelines, although I copied this out of the guidelines. More than one database. And I probably won't take off this semester because I probably didn't put it in the guidelines, but we definitely will for research. You could tell I'm already working on the research syllabus. And let's see. Oh, it says more than one should be searched. Good for me. Okay, never mind. I'll cross that off. Discuss how you perform the literature search, meaning what search words did you use, what limits. And then this is why I want people to read this before, because otherwise you won't have this information. How many articles, how many hits did you get? So you did CINAHL, you got 100. You did PubMed, you got another 50. So you ended up with, like, say, 150 hits, although some might be obviously duplicates. So, but I'm going to say you had 150 hits. You're choosing 5 articles in total. And they don't all have to be research. So you may end up with just like 2 research articles. But you'll have 5. I'm sorry, I'm just confusing you. Erase that. You have 5 articles in total. How did you get from 150 to 5? And the answer you'll probably write is one of 2 sentences. These articles were the most relevant to my topic of stress. Or these were the most relevant, and the research articles were the highest level of evidence, which you may not do this semester because you might have forgotten your undergraduate research. But you need to give me some sort of rationale why you chose that 5 articles. And let me tell you, because this happens every semester, believe it or not, don't put in because you had to choose 5 articles. That's not a good rationale. Why did you choose those articles? Okay. The intervention. One stressor and one intervention. Okay, so, or instead of the word stressor, let's say the word issue. One issue and one intervention. Don't say that somebody was an alcoholic, somebody else had bad nutrition. Make it easy on yourself. And also, if you start to do your lit search, I have 2 things to say about that. If your original intervention doesn't have a lot in the literature, make it easy on yourself and switch to a different intervention. Don't spend like days searching. The other thing is, if you've searched for an hour or even 45 minutes and can find nothing, write to Virginia Young, who's our librarian, and that's in somewhere on Blackboard that I have that information, but her name is Virginia Young, and say, hey, you're doing this paper for Melanie Kalman, Dr. Kalman, whatever you want to call me, and this is what I have to do. I need one intervention for anxiety. Can you do a lit search for me? The thing is, and I know a lot of professors are going to say you have to do your lit search, but when you graduate as an NP, you're going to have to do lit searches. The new drug is coming out, a new disease of the week comes up. You're not going to have time to do your own lit searches. Get the librarians. They're great. The librarian knows all of the medical terms, which we know, but she or he also knows the MAP terms, the ones that CINAHL accepts and the different ones that PubMed accepts. I'll be honest. I do, because I do research, I do lit searches all the time, and I never do my own lit searches. That's something I can have somebody else do. So it's not cheating. If you ask her, I'd say try yourself, but don't waste a lot of time on that. Okay, so if you're discussing the intervention and it's guided in imagery, don't give me articles about CBT. You need to be logical here and follow the flow. That makes sense, right?
Yeah.
Reference list, 5 articles in total. Some may be on alcoholism, some may be on the intervention, some may be on background, like statistics and stuff. As long as they're totally 5. They should be within the last 5 years unless they're seminal. And you'd be surprised at how many are going to be more than 5 years old. I'm trying to think of issues. You know, I don't think there's a lot of, if you're talking about alcoholism, I don't think there's a lot of new things we're doing. So they might very well be more than 5 years old.
And that's okay if that's all we can find?
Yep, just shoot me or the person who is grading your paper, hey, this article is more than 5 years old, it's on, and this is why I'm choosing it. They don't have anything more recent, or this has so much good information, whatever. And then that'll be fine. Just get an okay from the person grading you.
So what if we find an article on alcoholism? Because I have the issue of alcoholism.
I'm
And
so
it
sorry.
starts talking about substance abuse, as in illicit drugs. But you still really want the information about the alcoholism out of that article. Will you accept that, or because it starts? Okay.
Yeah. You know, as far as I'm concerned, I give you guys, I want you to critically think. So I don't want to give a lot of approval. You know, I want you guys to make the decision. And if you can give me a good rationale, I'll usually accept it.
Okay, good. Thank you.
So then somewhere I said a page for each article, which makes no sense. Clearly I was drunk when I was reading that, and I'm not allowed to have alcohol, so I don't think that was it. But it's like a paragraph on each article. This is where you need to be careful with plagiarizing. And where I see people plagiarize accidentally, and I use those words in quote, they sort of cut and paste the statistics. So don't bother putting in odds ratio, don't put in confidence interval. Just say the results were statistically significant or were not statistically significant as far as, and then whatever it is. So just reword it. You don't have to go into a lot of detail. And I think I have exactly what you need to do for each article. You know, what was more or less the research question I think I put in. What was, I know I have it. What was, what did they look at? What was the population? What was the finding? That's it. So you do that for each of the articles. Each of the articles, I'm sorry, about the intervention. So not about alcoholism, but Ashley, do you have any idea what the intervention is going to be?
Yeah, I chose motivational interviewing. I went to go do family therapy, but there was no direct
I said that
articles
yeah.
about this. So I broke it down into motivational interviewing, and there was a bunch more.
Good.
So that's what I ended up doing.
Good. So take all your articles on MI, even if it's just 2, or however many they are, and do these these paragraphs.
Right. So I have 2 studies that have such and such results, and then the other 3 are more educational studies and articles that don't have results, but they're just articles about alcoholism and MI.
So just do the 2 research articles as far as talking about it in this section.
Right. So I would only put the 2 that I found that were studies, and then the other 3 for other information, and that is fine, correct?
That is fine, correct. And let me tell you all, and Ashley just said something great that you're going to have to remember next semester, and I'm sorry I'm jumping ahead, I didn't with the last group, but look for the words results. 2 things to tell if it's research. If it has a section called methods, and if it has a section called results, then you'll know if it's research. And that's whether it's qual or quantitative. So those are just the 2 articles. So after you do those paragraphs, then take those 2 articles and synthesize it. It's a lot harder I understand, to synthesize 2 articles, but you could do it. It's sort of compare and contrast so that they agree on this. They agree that motivational interviewing works. However, one article said you have to do that. You have to teach them 3 weeks. The other article said 6 weeks. So you talk about the differences. And then if you could tell there's gaps in the literature, such as, let's say, Ashley's patient who's an alcoholic is a veteran. You can say, but neither one of them discuss the veteran population, and they have their own issues. I mean, every population does. Does this make sense?
Yes.
And this is exactly what you're going to have to do next semester, too.
Can I ask a quick question? I'm sorry.
Sure.
So the section G, the synthesizing the literature, that comes after the references?
Oh, no. That comes after. Oh, look at that. That's pretty stupid of me. No.
Okay. I just wanted to make sure that I put it right when I do the paper.
Yes.
So the references still come last.
Yes.
Okay.
Write that down to.
Okay, thank you.
References definitely come last. You discuss each article, and then the next paragraph is synthesized.
Okay, thank you.
No problem. Then discuss very briefly, every paragraph, don't forget, has to be 3 sentences. So you could do it in 3 sentences, how you would evaluate the intervention. You could use up a sentence by saying it's important to always evaluate, and I would telephone the patient every week. The reason I'm doing that is to see if she's still exercising. Then you do the conclusion. In the conclusion, there's no new information. So that don't throw in the CDC says blah, blah, blah. That should have been earlier. So this is just sort of repeating. Plagiarism, the only thing I want to say about this whole thing is don't forget, we don't look at percentages. We're looking to see if there's any words that you could have rewritten. And be nice to yourself. You can't, if you're talking about diabetes, you can't, if it says diabetes may result in heart disease, stroke, that's still heart disease, I'm sorry, that's my area, neuropathies, there's really no other way to write that. But use, again, critical eye to see if you could rewrite it. I don't want to scare you too much because I got everybody crazy with the first paper. If you did fine with the first paper, you'll do fine with this.
Dr. Coleman, on that note, is it okay just to title this family intervention paper? Because I'm sure that'll come up a million times.
Yes, yes, exactly. And what always comes up is the purpose of this paper.
Right. Yes.
So there's nothing you could do.
Okay.
I was going to say something, and what was it? It wasn't about plagiarism. It was about something else having to. I don't remember. If I remember, I'll make you guys a note. Anything else?
Should this still be averaging like 7 to 10 pages like the last paper?
That would be nice, but I tell you the truth, I don't hold to paper size.
Just
I
answer
put
the
that
question,
in.
right?
Pardon?
Just answer the questions and whatever length that is.
Exactly. And some people can write very sparsely and get it all done, and some people need a little bit more. So I personally don't take off if it's more than 10 pages. I would suggest you read guidelines, because definitely faculty do. We're all different, you're all different. I'm not going to keep saying that. I just wish we all did APA the same way, but I'll get over this.
Oh, I wish they'd all did it the same way.
Well,
I lose on one and gain on another.
yeah, I think this is the only semester you'll have trouble. I think so. So I think the rest of us are on the same page. So, so that's it for me. Anybody else? Be quiet. I am recording this so you can re-listen to yourselves and me.
Dr. Coleman, I just did want to just tell you that in the folder for the family intervention paper,
Yep.
it says that the exemplar talks about research last year, but not to worry because you don't have to this year, but we are, right?
Not really. You're doing very little.
Well, I mean, just about the lit search and stuff.
No. Oh, the lit search piece, yes, but that's not research. So if you read the exemplar, I had them, and God, I was nuts. I had them evaluate the research. And then when the paper was over, they said, hey, we don't take research till next semester. And I'm like, well, I thought two things. First, I thought you all had undergraduate research, and it's the same thing. But then I went, ugh, duh. Of course, research is something you only remember when you're taking it, unless you're actually doing research. And unfortunately, those of us who teach research are the ones who are doing research. So we keep forgetting that you guys, it's a different language and you don't retain it. I know it.
I'm sorry, it cut out when you said what you had them do that you're not having us do this year.
You evaluate the research, and they didn't have the research until, again, the semester afterwards.
Okay.
And I thought because they had undergraduate research, they'd be fine, but I was wrong. And I didn't take, not that you care, but I didn't take off from them because I could see it was a mistake. But yeah, so I took that whole thing out. Yes, you have to do the lit search, but you should all know how to do a lit search and what's important. So that I'm not feeling guilty about. But yeah, and that's why when you talk about the intervention, you're just talking about what's the same and what's not, and getting used to reading articles.
Okay.
So I update everything every year, so there are changes with exemplars. Yeah, but I'll just let you know. So, or I won't. Well, I will in research. So, anything else? Okay. Oh, I know what I wanted to say. If you need an extension, with this one, it's going to be hard because, again, I have to have everything in by the 11th. But we do have some wiggle room, but you have to tell us before the 2nd. Otherwise, it's not fair to your classmates. If you didn't get it done and you ask us on the 3rd, that's not fair. But if you ask us on the 1st, that's fine. So I wanted to remind you about that. Okay. Anything else, guys?
Thanks for taking the time.
Thank you.
No problem. You take care.
You too. Have a good night.
Bye-bye.
Thank you.